Good morning. My name is Dr. Carragans, and I'm a dentist here in Garden City, New York, right across from Roosevelt Field, the new Neiman Marcus building. And the purpose of this video, and I do them periodically whenever something comes up that I think is important. And basically, it happened this morning. Uh, there are two things that dentists treat, in my mind anyway, that are life-threatening. One of them is oral cancer. We don't necessarily treat it, but we're the first to diagnose it typically. And the other is sleep apnea. And I say sleep apnea only because of the fact that we see patients probably more often than the physician. There are a number of oral symptoms that alert us to the possibility that someone is suffering from sleep apnea. The overwhelming statistics on the danger of sleep apnea with strokes and heart attacks, etc. People falling asleep at the wheel and causing accidents, all the things that are now slowly but surely coming to the forefront. And anyway, so what I want to talk about today is something that we recently got involved with. And for a number of years now, we've been fabricating oral appliances for patients with mild to moderate sleep apnea, or for people who just won't wear a CPAP. Now, the CPAP is always the treatment of choice from severe sleep apnea. If someone has mild to moderate, they can opt out of a CPAP device and utilize one of the oral appliances that are available. Now, the problem that I had when I first started doing this was that there was no real science behind what I was doing. Treatment of sleep apnea has been documented on numerous occasions, the use of oral appliances, etc. But I personally felt that there was something lacking. And what we were doing basically, we're using the standard technique of fabricating an oral appliance and utilizing the movement of the mandible forward, 60% of the anterior-posterior spread of the protrusive movement, and fabricating an appliance at that point, 60, 70%, whatever it was. And it was sort of arbitrary. No one ever said, well, why not 62%, 48%? Didn't make a lot of sense to me, but that's what I was shown when I first started doing this. And it always bothered me, because we would send people out for a secondary, you would do a sleep test first. Someone with mild to moderate sleep apnea, we'd go ahead and make them an oral appliance. We'd retest them a couple of months later, and hopefully they improved. And if they did, well, was it total improvement? Was that the best that we could do? And the second question was, well, if they didn't improve, what do we do? Do we move them forward more? Do we move them back? It made no sense. But that was at least that's what I had available to me. Now, there are many people out there who were probably doing this far more scientifically than I was at the time. So, being an obsessive compulsive, as most dentists are, had to find out what the answer was. Well, I found out what the answer was. I took some courses and met some people from Sleep GS and learned how to capture real data, so that in the fabrication of an oral appliance now, we know beforehand, once the diagnosis has been made by a pulmonologist, and if we're going to make an oral appliance, we have much more capability, much more data to determine what type of appliance to make, where to position the jaw. We can test it beforehand, we can test it after to see if our results are better. We can maximize the improvement, and it's all done basically utilizing non-aggressive, passive type of equipment. So there's no harm to the patient, no injections, no crazy stuff. It's using a pharyngometer and a rhinometer and understanding the airway. We now can fabricate an appliance with a great more comfort to ourselves, with the feeling that we're actually doing something scientifically. And I think it's important for patients to know that. A lot of people out there have sleep apnea. The more we question our patients, the more we talk to them, the more people, not only do we find that our patients are potentially have a problem with their sleep, but that their spouses do, friends, kids, relatives, it goes down the list. And it's an overwhelming number. And many of these people aren't being treated, one, because they don't know they need to be treated, and two, if they do believe that there's kind of sleep problem, they don't want to go do a sleep test at some facility. They don't want to wear a CPAP device. They see it on TV. They know what it is today. If there's a fear about wearing something of that nature, it keeps them out of treatment. That's a shame, because that's life-threatening. You know, in dentistry, we deal with teeth, and we deal with other things, but basically we deal with teeth, and we can fix almost anything today. If there's a problem, we can fix it. It's rare that there's a situation that we can't control. But when it comes to something like sleep apnea, that's a whole different story. Because with teeth, the worst happens, you lose a tooth. I'm not saying it's a great thing, but we'll fix it. If you have sleep apnea untreated, you can die. And many people die in their sleep due to strokes or heart disease, heart attacks, because of lack of oxygen to the brain. And those are the ramifications of that loss. And this can be treated, and can be treated successfully, and be treated in a way that we can predict success. Now, are we 100%? Of course not. Nothing in life is. But we certainly can, at least we in my office, and the people that I am now associated with, can go out there and definitively say to somebody, we can help you, because we have the data behind it. We have a baseline that we create. We can then see when the airway is totally collapsed, and we can then look at improving that airway and getting it as close to the baseline as possible using an oral appliance. Now, there are lots of people out there. CPAP, once again, if someone's using a CPAP, terrific. There are a lot of people who either can't wear them, don't like wearing them, and sometimes just don't do anything because they're not using their device and they don't know anything more about treatment. They don't know that oral appliances are available. So this video is just to say, I apologize if the screen is weird. It seems to be fading in and out. But it's just to let people know out there that there's now a way to treat sleep apnea using oral appliances. Far more credibility in my mind, far more control, more effective. And for me, that was important. Now I am confident that when I make something, if I fabricate an appliance, that I'm truly helping that patient. It's not guesswork. And prior to this, a lot of it was. That was based upon research and based upon what people felt was important, and that where results were obtained. It just wasn't, to me, the right way to do it. And I think now we've got a much, much better handle on it using these data-driven devices. So anyway, that's my story. The treatment of sleep apnea today with oral appliances, I think, has advanced to a far more scientific level. If you know anybody that has sleep apnea, anybody's concerned about it, make sure they go ahead and seek treatment. If they're in Garden City in the area, give us a call at 516-741-1230. If you live anywhere outside of New York, find somebody. If you have a problem and you don't know who to call, please give me a call and I'll do some of the research for you in your area. There are dentists all over doing this and doing it very well. Don't let this